Hello, everybody. Welcome to the Brain Kids research team. This poster shows the results of a pilot study of repetitive transcranial magnetic stimulation as a treatment for Tourette syndrome in children. The study was led by Dr. Cynthia Kahl, who completed her PhD with Dr. Frank MacMaster at the University of Calgary. To start with, Tourette syndrome is a neuropsychiatric disorder characterized by brief, repetitive movements and vocalizations called tics. Treatments for Tourette syndrome include medications and a comprehensive behavioral intervention for tics therapy, but unfortunately, medications can have side effects and the therapy does not always work. Therefore, new interventions are needed. Repetitive transcranial magnetic stimulation involves a safe, non-invasive application of a magnetic field to targeted brain areas in order to change the brain activity and function. The goal of this research study was to characterize the effect of low-frequency, 1 Hz repetitive transcranial magnetic stimulation to the bilateral supplementary motor area on Tourette symptoms. This figure is a 3D rendering of a brain from a participant who participated in the study from the MRI scan. And as you can see in the middle, the supplementary motor area has 2 target sites. Each of these targets is 1 centimeter from the midline into the corresponding hemisphere for bilateral stimulation of the supplementary motor area. The left and right motor areas are also highlighted through a finger tapping fMRI task. Our second goal was to identify TMS-mediated alterations in brain metabolites that serve to normalize cortical activity, and the hypothesis was an improvement in Tourette symptoms would be moderated by TMS-induced changes in GABA and glutamate neurometabolite levels. This study worked with children aged 6 to 18 years old diagnosed with Tourette syndrome, and we had 10 participants. The participants did clinical assessments and MRI scans before and after 3 weeks of bilateral repetitive transcranial magnetic stimulation to the supplementary motor area treatment. The clinical assessments included the Yale Global Tic Severity Rating Scale, the Children's Depression Rating Scale, and a multidimensional anxiety scale. Our magnetic resonance imaging scan was about 1 hour to include the structural MRI images, the finger tapping task to identify the supplementary motor area and motor areas, and magnetic resonance spectroscopy voxels were placed in the supplementary motor area and motor areas of both hemispheres. The treatment included bilateral supplementary motor area stimulation, 1,800 stimulations a day or 900 stimulations per hemisphere per day at 100% of the individual's resting motor thresholds. And the treatment was 3 weeks, about 30 minutes per day. As you can see in figure 1A, all children showed a reduction in their tic severity symptoms from before to after the rTMS intervention. The average change in total Yale Global Tic Severity Scale score was 60%. The average change in tic severity symptoms was 46%, and in the impairment due to tics was 72%. Motor tics decreased by an average of 45%, and vocal tics decreased by an average of 48%. Children also reported a decrease in their depression rating scale of about 21% and a decrease in the anxiety scale of about 12%. The magnetic resonance imaging analysis identified a trend of increased GABA and decreased glutamate concentrations in the supplementary motor area and dominant hand hemisphere, but the opposite was seen in the non-dominant hand hemisphere with a decrease in GABA and increase in glutamate concentrations. The conclusions of this research study are that robot-driven, personalized, neuronavigated rTMS intervention appears to be feasible and well-tolerated in children with moderate to severe Tourette syndrome. There were no serious adverse events and no dropouts. The results indicate an improvement in tic symptoms, depressive symptoms, and anxiety after 3 weeks of rTMS treatment. Future randomized trials are required to demonstrate efficacy, and therefore the MacMaster lab has started a double-blind, sham-controlled research study of rTMS to the supplementary motor area in children with Tourette syndrome. This new study includes comprehensive behavioral intervention for tics, which is 8 sessions over 10 weeks, and it includes 20 sessions of the repetitive transcranial magnetic stimulation therapy. As a sham-controlled study, half of the children received the active rTMS and half received sham TMS in order to determine the exact effects of the TMS in reducing tic symptom severity in children with Tourette syndrome. If you have any additional questions, please email us at brainkids@ucalgary.ca. Thank you so much for listening.